Hello, my name is Zanani James, and I will be inserting and removing an NG tube for checkoff. So the first thing I'm going to do is verify my physician's orders. I'm going to go in, introduce myself, and check the patient's identifiers against the card. After doing this, I'm going to raise the head of the bed up into a high phallus position. So after raising the bed, I'll do my hand hygiene and put on clean gloves. Next, I'm going to check the patency of my patient's nostrils. Okay. After doing this, I'll put a towel on my patient for this procedure and give him a cup of water so during this procedure he can swallow as needed for the procedure. So next thing I will do is I'll take my NG tube and I'll measure it. So how I measure it is from the nose to the tip of the earlobe to the xiphoid process. Okay, I got 47. So I will take a piece of tape and mark that measurement on there. I will now take this NG tube and I will lubricate it 3 to 4 inches. Now that this tube is lubricated, I will instruct my patient to swallow as going down for this procedure. Tell him to tuck his chin to his chest. So now I insert. So I will secure that with a piece of tape. After securing this, I will check placement of the tube. I can check it by x-ray or gastric contents on a pH strip. Next, I will hook this to suction. After hooking that to suction, I will take off these dirty gloves, perform hand hygiene, and document. The things I will document will be the nair that was used, the confirmation of placement. I will document the characteristics of the gastric contents, the size and type of tubing used, and how the patient tolerated it. So next, I will go straight into the removal of the NG tube. So with this, I'll verify my physician's orders, explain the procedure. I'll go in and identify my patient. After doing this, I will put hand hygiene on and don clean gloves. Since I have just put my videos together, usually I will put a brand new towel on my patient's chest, but it's already there. So the towel's already there. I would unhook this from suction. After doing this, I will remove my tape from my NG tube. So after removing that, I will just tell my patient to take a deep breath while I am removing the tube from his nostril. So take a deep breath, remove, 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 remove. I'll take this NG tube and dispose of it in the proper container, and I will perform nose and mouth care after removing that tube. And I will take off these gloves, do hand hygiene, and I will document. Hello, my name is Zanani James, and I'm going to do enteral feeding checkoffs. So the first thing I want to do is go in, verify my physician's orders. I'm going to introduce myself to the patient and verify my patient with 2 patient identifiers and explain the procedure. So after doing this, I will do hand hygiene and don clean gloves. After donning my clean gloves, I would put the patient in high phallus, but the patient is already in high phallus. And I'm going to make sure to ask the patient of any allergies they may or may not have. I'm going to disconnect my NG tube, and I'm going to go ahead and get a residual. So I'll hook this to the tubing, I'll pull up what's coming up, and if it's less than 250, I'll go ahead and give that on back. If it's 500 or more, I would not give that back and I would stop the feeding. It could be 500 just in this, or it could be 500 on 2 different occasions, so 250 and 250. I did not get more than 250, I only got 30, so I'll go ahead and give that back to my patient. I'll go ahead and set this here. I'll set this, and I will shake my formula. I'll go ahead and draw up 30 milliliters of water so I can flush my NG tube. So if I was giving this feeding in a bolus, I would do it by gravity continuous. I would just hook it up to the pump. So after doing this, I would set this down. If it was an abdominal thing right here, I would go ahead and inspect the abdomen to see how the skin's going and cleanse the site. I would change my tubing every 24 hours, change my feeding when need be. I will do residuals, and I will flush every 4 hours with the tube feeding. After doing that, I'll go ahead and take off my gloves, perform hand hygiene, and document. I'll document the appearance of the abdomen, residuals. I'll document residuals, the appearance of the abdomen. I'll document the feedings, and if nausea is present, I would do so. And I will also document the I's and O's that were gathered while doing this procedure.